Good evening, I'm Christy Casciano.
I'm Jeff Kulikowski with Patients Caught in the Middle. Tonight, we're taking an inside look at the dispute between one of the largest local health systems, St. Joseph's Hospital, and the largest local private insurance company, Excellus Blue Cross Blue Shield.
A battle over reimbursement rates that could leave up to 50,000 people starting the new year looking for a new doctor. NewsChannel 9's Andrew Donovan sits down with leaders from both sides of the negotiations.
Dr. Stephen Hanks manages Trinity's hospitals in Syracuse and Albany. His hybrid role is a way to save money.
I'm responsible for 29 different organizations, a number of hospitals, nursing homes, assisted livings. All of those entities 20 years ago had their own CEO.
It's this entity, St. Joe's, facing major losses, $150 million the last 5 years.
Without Trinity's backstop, we would have had no choice but to either go through a bankruptcy proceeding.
It's why St. Joe's expects more for treating patients covered by Excellus to balance the books. St. Joe's gets only 70 cents on the dollar back from the government for a Medicaid patient. Hospitals rely on private insurers to make it up, which is at least $1.30 for every dollar, something Excellus's chief medical officer says can't be done.
I think some people are asking, should St. Joseph's budget problems be Excellus's problem?
Well, we would love to, be able to really meet the increased cost for every single hospital. That's not possible. It's not sustainable.
Dr. Hanks says Excellus insures so many local patients, it needs to pull more weight.
I have the benefit of seeing rates across all of Trinity. We operate in 26 states, over 100 hospitals. The payment we get here at St. Joe's from Excellus is the worst commercial payment rate in all of Trinity.
St. Joe's has financial advantages that many other local providers don't have. They're part of Trinity Health. That's a large, profitable health system.
Either way you look at it, healthcare is getting more expensive. If a deal isn't done by January 1st, St. Joseph's patients who rely on Excellus will have to pay out-of-network costs or find another covered provider. If a deal is done, Excellus will likely charge its members more for insurance.
I'm concerned that the member may unduly be put in the middle around conversations that happen normally. And that can create a great deal of fear and anxiety for a member when that's not really necessary at this point when we're in the midst of just having a conversation of how we're going to come to agreement on a contract.
We are doggedly working to try to avoid that outcome and come to agreement by the end of the year. And I'm still hopeful that that will happen, though there's still considerable distance between us, but we are making progress.
And their patients are losing patience. In Syracuse, Andrew Donovan, NewsChannel 9.
Now, St. Joe's says Excellus insured patients who need continuing care like cancer treatment or active pregnancies might still be covered in the new year.